So this is another question I probably could write like an entire book chapter on. So it really just depends on how large the seroma is, where it is, and how many attempts you've had at draining it. So in general, the whole process that causes seroma is just the tissue weeping fluid after surgery, and this will stop at a certain point in most patients. So if you drain the seroma, keep compression, it often will just go away on its own. And sometimes you need to do this several times. The problem happens is when the seroma stays long term and it can develop a capsule around it, similar to a breast implant capsule. And then the seroma just won't be absorbed. Even if you drain it over and over again, it just keeps coming back in this smooth capsule. So when that happens, there's a variety of treatments. You can go back in and remove the capsule, put a drain in, try to compress the area. You can take the fluid out and use sclerosing agents that kind of rough up the capsule. You can do it manually, you can do it with chemical agents, and then see if you can get that capsule to collapse down. That's kind of the main reason main way we get rid of seromas. I've actually had a patient who had a seroma for 7 years with multiple attempts, and I was able to get rid of it through kind of my Hail Mary type method, which is where I open it up, remove the capsule, and I leave it open and let you heal by secondary intent using a wound vac. And it takes about 4 to 6 weeks for that to happen. But that's really an option when you've kind of failed everything else and you just want to do the last ditch effort, because it's not fun to have a wound vac for weeks and weeks. But seromas can be super simple to deal with and they can be super complicated. The key is, again, see a plastic surgeon who's comfortable and experienced with dealing with seromas.